Ene nya Kofi ne mje ma na men ka ho.
Yes, sir. And that's it. I'm going to say me train on ya. And across so it'll be a lot of English, but me tree no but as you can see right there should be less tree. Got it. Understood. Let me go ahead and share my screen here. You guys able to hear me well? Thumbs up. Excellent. Thank you, sir. All right. Osteoporosis. That's my name there. So what are we going to talk about today? This disease condition, osteoporosis. What exactly is it? Well, if we look at the word itself, just break it down. I'll tell you exactly what the condition is and what sort of is going on. And by that, we can infer what should be done about it. So osteo, Latin, actually means bones, right? So osteo, every time you hear that term, it's referring to your bones in your body, the structural makeup of your body on which upon your muscles and your tendons are linked. Porosis, this type of suffix here, what it means is holes. So quite literally, it means holes in your bone without even reading any of this complex stuff on the left side of the screen. We see here what we're talking about are holes in the structure of the bone. So how do these holes occur? So before we even talk about that, let's talk about the difference between osteoporosis and osteopenia. So as we talked about, osteoporosis meaning holes in your bone. Osteopenia, penia means weakness. So osteopenia is a weaker form of osteoporosis, meaning that this weakness can progress towards holes in the bone. But the whole point is that your bones are actually getting a little bit weaker, meaning they're more prone to actually getting broken or having problems with them. How does this occur? Well, there are two main things that are going on whenever someone has osteoporosis. One is a decrease in bone mass, and two, a decrease in bone structure, or I should say disrupted bone structure. What exactly is bone mass? What that means is that the weight of your bones are not as heavy. And we'll talk about what that means. What it basically means on the surface level is that the materials that keep your bones nice and strong are in low supply. So you don't have enough of the stuff that keeps your bones nice and hard. Secondly, all that stuff hangs on a structure. Here's what it looks like here. And this is something called a SEM, scanning electron microscope. It's basically a picture of your bones when you magnify really, really, really strong. This is the structure of your bones. On the next slides, we're going to talk about what that structure is. And either this structure is messed up, and so the mass part of it can't sit on the structure, or the structure is fine and the mass really can't make it more thick and dense, or both of them together. Usually they occur together. How does this happen? Well, there's three main ways it can happen. One is increased age. As you see, I'm just as bald as my father is. Uncle Quincy Prince is getting there as well. One day we'll all be there. But as you get older, you get bald, your bones get weaker. That's just a natural part of life. The second way that happens is menopause. We'll talk about what this exactly means and how women getting older can result in bones that look like this. It's a natural process in a second. And the third one is the metabolic abnormalities. We'll lean on all three of these things as we move further in our discussion, talk about how these three things can cause osteoporosis and what can be done about all three. So back to the osteoporosis again, just to recap, bone holes or bone being weaker. So what is that? You guys just ignore all these words here. The whole point of this is just to show that there's a structure, and ultimately the structures are broken down into small things. Don't get too lost or confused about this. Just one of the cool pictures I found on Google Images. So here's the bone here. This is somebody's hip bone. And this whole picture is basically telling that if you take this and zoom in very far, you have these collagen molecules. Collagen, this is protein. So your bones are mostly protein. These are large linked pieces of protein. And upon the protein, you have these crystals. So bones are basically crystals on top of protein, a bunch of elemental crystals that are on top of this protein. Here, look at it in a different way. Another picture with different colors saying the same thing. This is your bone. Your bone is, this means like this picture here is basically this zoomed out. Your bones are thick proteins, and these thick proteins have a crystal that lays on top of it. Crystal that lays on top of thick protein. Another way, just to look at it a third different way. What we're looking at here are bones. Bones are broken down into small fibers of protein, and these protein fibers have these crystals that lay in on them. And here to break it down, what those crystals are a bunch of different chemicals, but the whole point is this here. You guys see all this? Calcium 2 plus, this Ta2 plus means calcium. Calcium is the most important part of the crystal that lays on this protein structure. So to bring it all bone, normal bone is basically made up of a bunch of protein fibers upon which we have crystal structures made mostly of calcium that sit in there. So you need good amount of protein and good amount of calcium to make nice, strong, healthy bone. That's because that calcium sits on top of these proteins. All right, moving forward. Another confusing slide. Like don't even pay attention to most of this. This is here just to show 4 main things that are happening to get normal calcium in our blood. And then we'll move forward. The main point is that in order to have normal calcium getting onto this part of the bone here, we need something called vitamin D. Vitamin D. D as in Delta. You guys have all heard of it before. Vitamin D helps calcium get into the bone by helping it get into your body better. And there are 2 ways that vitamin D actually can really help you get into the body. One is by ingestion, eating it. Whenever you're eating food that has a lot of vitamin D in it, and we'll talk about what foods that are in a little bit. Whenever you're eating food that has a lot of vitamin D in it, it helps you increase your calcium intake. And by increasing your calcium intake, promotes good, strong bones. The second thing is sunlight. I know it sounds strange. Sunlight actually activates this vitamin D so they can again get into your system. And by getting into your system, your calcium gets into the bone. And by calcium getting into the bone, gives you nice, strong bone fibers. Well, the whole point is you increase your bone quality and structure by 2 main things: sunlight and then getting more vitamin D and calcium into your system. So we just blow it up again to recap this, because the whole talk really hinges on those 2 principles. There are these protein structures here that what your bone is made out of. In order for these to be nice and strong, you have a bunch of calcium crystals that are formed and sitting on them. Whenever you don't have good amounts of calcium sitting on the bone, the bone's going to end up looking like this, having a bunch of holes in the bone. And these holes in the bone are a condition known as osteoporosis. So why should we care? Why does it even matter? For me, I like fixing bones, so it's important. But why on earth would anyone else care about bones, whether or not they're strong, whether or not they're weak? Well, weaker bones tend to break. And we have all heard of something called a fracture. Fracture just means a broken bone. And when bones break, you have to put them back together, usually. Unfortunately, when people break bones, you usually need to immobilize things, meaning that bones are not a very smart type of tissue. They're not like the liver, which can make more of itself and become healthy again. Bone usually just has to heal itself by being stiffened, meaning you just put a cast on it like you've seen before, and you put a cast on it and it gets immobile. And from by it being stiff, it can be healed. The problem is when you break certain bones and you need to have a cast or to be immobilized for a while, that's actually associated with dying sooner. All that to say, people who break their bones more often, especially in particular areas, actually tend to die sooner. So by increasing the quality of your bones, making your bones, or I should say, keeping your bones stronger, it can prolong your lifespan, because you're up and can be up and mobile and being active and exercise and doing all these things and evangelizing and walking the streets instead of sitting down in a bed and dying sooner. So your bone health is important to make sure you can have an extended, long life. Incidence. So incidence just means how often do we see this condition, osteoporosis? Well, here in America, 10 million Americans actually are diagnosed with the condition, meaning that people who have the diagnosis, we know about 10 million people at any point in time, but up to 200 million people worldwide have the condition. Even more people have osteopenia, which again is just the less severe form of osteoporosis. Usually when you have osteopenia, it will progress to osteoporosis without some type of intervention, unless you do something about it. 1.5 million osteoporotic people have fractures every year, meaning that there are broken bones 1.5 million times. Are people with weak bones having fractures needing to be immobilized. And if we break down these fractures just means broken bone, into 3 main common types. Here is where we get to the whole point of the talk. Most of the broken bones are what we call vertebral fractures, meaning in your spinal cord. Usually they don't need surgery, but at least they're hurt, they're painful. You usually have to be bedbound for a while, so it's not healthy. If I skip this one here and move to wrist fractures are the 3rd most common. These are, again, usually not very, they don't really affect your life too much. Usually you can have a quick surgery or a cast on it, but still it's a lot of pain and you have to take pain medications. It's not a good thing. Here is the big point here. The 2nd most common one are hip fractures. Hip fractures, you know where these are. It's the place, where Jacob had his hip broken. That's the part. That hip fracture is what the Holy Spirit did, what Jesus did to him back there in Genesis. The problem with this is that you're immobile. Your hip is going to be a problem. And without surgery, you usually can't walk for months. And people who have hip fractures, their life expectancy is taken down way. Usually you die within a year, whether or not you have surgery with a hip fracture. The incidence is very high. So all that to say, there's a lot of people with osteoporosis, and that puts you at risk for fractures. If you do have a fracture, it happens to be a hip fracture, this is a big problem because the likelihood that you will live up to a year after the hip fracture decreases by about 20%. So increasing your bone health and keeping osteoporosis away is really good to make sure you can live long and avoid a bad fracture in the future. Here's a fracture of the vertebral spine. What we're looking at here is just a side view of your bones in your spine. So your head would be up here, your feet would be down here somewhere. This is just your spinal cord. This is what a spinal column. Your spinal cord would be behind it here. So this is the front, this is the back, this is your spinal cord where all your nerves are coming. Here's your vertebrae, your spinal column that protects the spinal cord here. And in this, we see that there are holes here. This is a dramatic picture of osteoporosis. See, there are holes in the bone, porosis in the osteo. So this is what osteoporosis looks like when somebody's just drawing a picture of it. Here's a picture of an MRI, which is a kind of an X-ray using a different technology to look at your bones. Just like the picture we saw here, remember the bone is here, the nerve is behind it. Here on this picture here, the bones are here and the nerves are behind it. These bones here are relatively healthy. You see that they have their nice normal shape looking like this, looking all good and healthy. But this bone here is been pushed down. It has a different color to it, and the tissue around it seems to be damaged. This is what we would call a broken bone in the vertebra. This is what a broken back looks like. It's called an osteoporotic compression fracture. These types of fractures happen, unfortunately, when people don't have strong bones. You have these types of fractures, and sometimes they need surgery. Looking at an X-ray now from the side, we see the same thing. Here's a nice, healthy appearing bone, but we can see that it doesn't look very white and bright. It doesn't look like it has healthy whiteness, that good amount of calcium in there. We see that it looks a little bit thinned. And as a result, there's been a compression osteoporosis fracture. This is a broken bone here. This is what we try to avoid by having good, strong, healthy bones. Here, going back to the diagrams again, is a hip. This is what a hip looks like here, looking right at the front. So this is the joint, this is the outside of your body here, and this is the hip bone here. So you tie your belt kind of around here. This is normal bones. This is what bone usually looks like. If we were to zoom in close, we would go back to that black and white picture we saw. If I would just flip back really quickly, this is what this would look like when you zoom in with osteoporosis looking like this. Going to our picture of the diagram here, this is the normal appearing bone with just small holes in it. And this is osteoporosis. This is what a hip looks like when it doesn't have good bone quality. You see these holes in the bone. This is what we try to avoid by having a good health. So this is osteoporosis of the hip here. Here's what x-rays look like when somebody doesn't have healthy bone. Here we see an x-ray of a hip. This is a person's normal hip bone. Look at this healthy white tissue. This is good, strong bone. See, there's a lot of calcium in here. This person is drinking the almond milk or soy milk, has been running every day. We see they have good, healthy bone. This is osteoporosis on x-ray. So you can even kind of see through the bone. We should say that x-rays are basically shadows. It's shadows of calcium. And so when we're looking at an x-ray of a good, healthy bone, we see there's a lot of calcium here, and this is the shadow that it casts. This person doesn't have a lot of calcium. This person has osteoporosis. And because of that, the shadow that the x-ray makes is very weak, is very thin. Look at this, you can barely even see it. This is not good. So this person is not careful. They're gonna break their hip. If they were just trip and fall one time, this is gonna break. And what happens when you have a broken hip that looks something like this? Here we see an osteoporosis type fracture. This bone is not healthy and white. Comparing it to this healthy bone, see how thick and healthy and nice this bone is. This one here, these white thickened parts are actually thinner than the other one. You see this place is pale. It doesn't look nice and healthy white like we want it to do. If we were to look at this here, this is a broken bone. This is what we call a hip fracture. This is a person's hip fracture right through their poor, not very strong hip. What happens when somebody has this hip is that they're bedbound for a day or two. If you live unfortunately, in the Krasi and Ghana City or in Seko City or Gen 2, you're going to be very far from a hospital. And so you're going to sit with your bone looking like this for a long time until you can pay a taxi to take you to Comfort Noche, a hospital that's somewhere even close. And when you get, fortunately, when you're able to get to that hospital, you're able to have a surgery where we put a metal rod and a screw to stabilize that hip there. But this alone keeps you immobile. You may be bedbound for days or weeks, waiting until you can find a trotro to take you to Comfort Noche. This sitting down, not moving for a long time, puts you at risk for problems. And so this is why it's important to keep your bones nice and healthy, looking like this, so that you don't have this problem and need this surgery. Demographics. Demographics means who does this happen to? Well, the female to male ratio is 4-to-1. That means 4 times as many women have osteoporosis as men. We're going to talk about why that is, but to say it quickly, it's because estrogen in your body, that chemical that sort of makes women women, in men it would be testosterone, but in women it's estrogen that actually keeps bones strong. We say it's osteoprotective, which means that it protects bones and keeps them strong. Whenever you have a decrease in estrogen, meaning whenever you hit menopause, typically when you're not making as much estrogen as you were before, your bones naturally get weaker. We're going to talk about what that means, but it means that a lot of women, especially women aged 50 to 60, have osteoporosis, which puts them at risk for fractures, which decreases your lifespan. So it's important for us to be paying attention to this and making sure our women are getting the appropriate bone protection programs from their doctors. Factors that you can use to prevent this, even though you don't decide whether you're a man or a woman at birth. Factors we can use is one thing, to be exercising when you're younger, because exercise actually promotes bone strength at a young time, and from the ages to about 25 to 30, we call that your peak bone mass. If you're exercising regularly around that time, your bones will be stronger later in life. So even though a lot of people, when you're a young man, you're thinking what you're doing doesn't matter, one day you'll be an acrocrat like myself, and it's important to make sure you're exercising and staying healthy when you're a young adult, so that when you do reach your bald acrocrat stage in life, your bones are healthier than if you had not been taking this seriously as a child. Other random facts, is just data, just to kind of bring some importance to the topic. When you do have a hip fracture, it's a 20% increase in mortality, meaning that your risk of dying increases 20% whenever you have a broken bone at 1 year. Even if you don't die, it's associated with increased morbidity, which means your quality of life is different. When we do this surgery, sure, the surgery takes maybe an hour to do, so 1 hour of work for us to do, but it takes 3 months of rehabilitation. You have to learn how to walk again. You have to learn, there's pain that goes into when you have pain, you have to take medications. Medications have side effects. So even though we can fix the broken bone and maybe you're able to live, your morbidity still, your quality of life is not as good because you're in pain and dealing with taking medications. Even in the ideal circumstances, we're able to get to Comfort Noche quickly and the fractures stabilized quickly. Only 1/3 of patients who break their hips return to the previous level of function, meaning only 2 out of 3 people can get back to their normal activities of dancing and singing in the choir and getting up and driving to church without severe pain. 1/3 of the time, even if you live, you're still going to have pain, and doing your normal activities is pain dominant stuff is not going to be as effective as it was before. Of note, a history of one hip fracture increases your likelihood of having another hip fracture, either breaking the same one again or the other side. Because remember, God has given you 2. Moving on, more important facts about hip fracture. In terms of the entire medical system, it's actually the most expensive fracture to treat on a per person basis. Talking about a specific type of hip fracture here. I mean that if you break your finger or you break your ankle, it's not as expensive as fixing a hip fracture, meaning that it's important to keep your bones healthy because it can be very costly if you have to have this managed. We talked about the mortality and how people who are healthier before they break their bones have a better outcome. People who have kidney disease do much worse. So it's important to be healthy in general. But moving back to the main topic at hand. Women and osteoporosis. So we talked a little bit about why women have an increased risk of osteoporosis. Typically, it's because estrogen, which is a hormone that protects bones, decreases sharply when you reach menopause. So when you don't have this protective chemical in your system as much, your body's not able to ramp that up and your bones will quickly become much weaker. On top of that, women tend to have much smaller, thinner bones than men. So even though we think that women are very wise and much smarter than us, bone-wise, women tend to have smaller, thinner bones. So it's important for all of our women in the audience, especially if you're between these ages, 50 to 70, to really be asking your doctor every time we go to doctor, ask him, what is my bone protection plan? Which is a strange question to ask a doctor. They may look at you funny. Then you can say, I talked to we had this young bald man, he came and talked to us about osteoporosis. And he said, I was told to ask my bone protection plan because I'm at risk for osteoporosis. When you say that to your doctor, he will quickly understand and say, oh, you need something to make sure your bones stay strong. That's what we're going to talk about here. I say it's important for us to bring up this topic ourselves with our doctors because, as you do know, there's something called health disparities. What health disparities means is that some particular people in our society have increased risks of bad outcomes just based on who they are. All that to say, mostly Black people tend to have worse outcomes with a lot of different diseases just because Black people aren't treated as well. That's supported by lots and lots of data. So it's important for us as Black people, especially our Black older women, to bring up the topic of bone health with our doctors, just to make sure, especially if your doctor doesn't look like you, to make sure your doctor is paying attention to things that we may be at risk for. Black people have a lower prevalence of osteoporosis, meaning that because remember we talked about vitamin D back here, because we're able to soak up more vitamin D in this part here, our bones are actually naturally more strong than white people and even Asian people. That's because of the melanin in our skin helps us be able to work with sunlight enough to have better vitamin D. So we actually have less osteoporosis than our Asian friends and our European friends. However, even with that, Black people, especially Black men and women, often go underdiagnosed because the screening is not as common, meaning that our doctors don't typically take our issues as seriously as people who don't tend to look like us. So our screening is actually 8 to 20% less likely to be screened, meaning that even though we have less actual osteoporosis happening in our community, we're often neglected in terms of having it treated when it is diagnosed. That's not good. Or even having it diagnosed when it's present. Reasons for these disparities in outcomes, meaning again, disparities means a difference in treatment amongst populations, namely Black people not getting as good treatment as people who don't look the same as us. Again, screening, we don't get as much screening. We're not getting, our doctors trying to pick up the disease more often than they are in other people, as often as they are in other people. We'll talk about the screening is in a second. Again, when it is diagnosed, we have up to 20% of the time we're treated just not as treated. It's ignored, we're just not paid attention to, which is kind of inexplicable. It's kind of weird, right? You would imagine, even though it's being diagnosed, why is it being treated? There are a lot of reasons why that may happen. Time to surgical repair. This to me is a main problem, meaning that when a person who is a Black, especially our old women, our Bourgeois, have a broken bone and they're in the hospital, data shows that if you fix the surgery within 2 days, it actually increases your likelihood of living by 1 year, or your outcomes are better the quicker you can treat the fracture, get the person back up and moving out of bed. For some reason, the time to getting the surgery done is much longer in the Black population than the white population, which just makes me very sad. That means that if two people who have the same diagnosis, each have a broken left hip, come to the hospital, and one person is white and one person is Black, the person who is white is more likely to get surgery sooner and therefore more likely to get back on their feet and increasing their quality of life quicker than the Black person. And that is still, and in 2021, that is still happening. Rehabilitation, even after the surgery is done, you need to learn how to walk again. Not meaning you've forgotten how to walk, but after your surgery, you have damaged tissue. You have to train those muscles to walk properly again. All that requires PT, physical therapy, to make sure you're getting the right rehabilitation to get back to your normal function. Black people are 30% less likely to not receive. I should say the incidence of us not getting physical therapy is 30% higher than those who don't look like us, which is a problem. And then, all that to say, we really need to be on top of us bringing it to our doctors, saying, hey, I was told that osteoporosis is a problem, especially if I'm a woman aged 50 to 70, and I need you to tell me how I can protect my bones. So back to the topic of Black women and osteoporosis, Black women in particular. 5% of African-American women who are older than 50 are estimated to have osteoporosis. That's 1 out of every 20. Another 35%, so 1 out of every 3, are estimated to have osteopenia, meaning their bones are getting weaker, but they don't yet have the holes in the bone. And even though, again, to summarize, even though when we do have those risk factors, meaning things that point towards osteoporosis, few of us are screened. So we really need to be taking it to our doctors saying, hey, well, why do we need to do this? Other reasons why Black women may have osteoporosis. That's because, as we talked about before, bones are made up of two main things. We talked about the protein structure, those structural proteins that bones are built out of, and then the calcium crystals, calcium type of crystals, which are laid onto those bones. So if you're not getting enough calcium into your diet, you're not getting very strong bones because the calcium isn't getting in there. A lot of calcium is found in milk products, or even fake milk products such as cheese and milk. And if you are lactose intolerant, you're not able to eat those milk and cheese products, yogurt, etc. 70% of African Americans are lactose intolerant, meaning 7 out of every 10 of us don't handle milk well and cheese well. Because of that, we tend to be calcium deficient, meaning we're not getting enough calcium into our bodies. And because we're not getting enough calcium into our bodies, our bones reflect that by not being as strong as they could be. Many African American women don't get enough vitamin D. United States, we also have other diseases that may lead to us having osteoporosis, such as lupus. It's more common in Black people. So all that to say, Black women can be at risk for osteoporosis and definitely at risk for not having it diagnosed or screened for, which means we need to take the topic to our doctors. Screen for. So we talked about screening being a problem. What exactly is screening for osteoporosis? Well, screening for osteoporosis is done with something called a DEXA scan. Complicated stuff. Basically, this just means they take an X-ray of the bone and look at how thin the bone is. So just like look at this picture over here that we talked about. This is a nice, healthy bone. We could say this is a DEXA scan. Look at that. This is a nice person, younger than me, has good, strong, healthy bone. This person's DEXA scan would say, hey, there's a problem here. This bone is weak. And that's how you screen for it, by taking that little X-ray in this machine here to see if the person actually has good, strong bone or not so good, strong bone. Whenever it's nice and strong, it'll be there's a computer that tells us the density of the bone, whether or not it's good, green, whether or not it's not so good, yellow or orange. This would be osteopenia, as we talked about, or if you're in the red zone here, which is osteoporosis. So screening means that you should be asking a doctor, I need to have you checked. What's my bone protection program? And they should say, looks like you need to have a DEXA scan to screen for osteoporosis. You'll then take a little X-ray and then have a diagnosis if it is there. So again, before we get a little bit technical, I want to recap one more time. What is osteoporosis? Osteo means bone, porosis means holes in the bone, and it's disrupted bone mass and structure. The structure is this protein, things that we have here, and upon which you have these calcium crystals that sit on there. When you have a decrease in the protein or a decrease in the actual calcium crystals, you end up with weakened bone, and it's called osteoporosis. So how do we prevent these weakened bones from occurring? The two main things are going to be essentially in your diet and supplementation and exercise. The first thing we can all do is regular weight-bearing exercise, weight bearing. What this means is that by exercising with weight, your weight can be your body weight as well, meaning standing up and down doing squats, or you're using even biking. That's sort of weight bearing if you're doing it properly. It causes muscles to pull on tendons. Tendons pull on bone, and bone, when it is pulled on, becomes stronger. Let me say that again. Muscles, they contract whenever you fire them. They pull on tendons, which pull on bones. And bones, God made us in such a way that when you stress bones, when you pull on them, the bone becomes stronger. This is actually how children, they're born with cartilage in their bones. As they grow and start walking, their bones become stronger, because by just walking and doing the normal things of life, you pull on bones and they become stronger in that way. Also is why astronauts, when they're in space and they don't have weight pulling on them, their bones get weaker. Astronauts are actually at risk for osteoporosis because when they're up there not exercising, the bones don't get stressed, they don't get pulled on. There's no weight for them to be pulling against, so the bones get weaker. So by exercising, that's the number one way to prevent osteoporosis and therefore prolong your life, by exercising. Therefore, we need to really be important about balance training, getting trained appropriately, making sure that you're going to the gym to stay healthy, so that your bones are getting the appropriate stress and weight bearing they're getting, so they stay nice and strong. This smoking cessation, alcohol intake, not really important for our community because we are good LNG Power believing people that don't need to smoke or drink alcohol. And the second thing we'll talk about here, I think this is really important, is supplementation, which means taking additional vitamins in addition to your normal diet to help this strong. There's two main things. We talked about vitamin D, and we already talked about calcium. We don't need to go back to the diagram, but we already know that vitamin D is important for getting calcium into your body and therefore into bones. Meaning, by having both of those in an appropriate level in your body, your bones will stay much stronger than not having them in your body. We're going to see on the next two slides that trying to eat enough, I'll say it again, trying to eat enough vitamin D and calcium to keep your bones healthy is actually not the easiest thing to do. It's difficult to eat enough foods that have enough vitamin D and calcium to really get to an appropriate level where your bones stay strong. This is why most doctors who treat people's bones, including your primary doctor, people who do rheumatology, and especially orthopedic people, will recommend taking supplements, taking extra vitamin D and extra calcium pills on a normal, regular, daily basis to make sure that in addition to your normal diet, you're getting enough vitamin D and calcium. Breaking it. So this is your bone protection program. That phrase that we brought up that was there about 5 slides ago. This is what you should be asking your doctor about. Say, doc, I heard I'm at risk for osteoporosis. What is my bone protection program? Your doctor, if he or she is good, should say, number one, exercise. You should be exercising at least 30 minutes a day, just so you're making sure you're pulling on your bones and making them stronger. The second thing I would say, I put it over here, is making sure you're getting the appropriate screening. Screening meaning that DEXA scan, which usually needs to happen once every few years. I think it's once every 5 to 10 years, really, because osteoporosis takes a long time to develop. You don't need to be getting this every year, like you would be checking for other conditions. It doesn't need to happen that often, but you should be getting sometime. You should know when your most recent one is. And then on top of it, I think the third part of it would be vitamin D and calcium supplementation. So this is here, prevention, not treatment now, but prevention of osteoporosis. What we would say a bone protection program is going to be a three-headed thing of exercise, supplementation, meaning vitamin D and calcium, and then screening, making sure that your doctor is making sure to take the x-ray to make sure you don't have osteoporosis. So focusing in on this part here, vitamin D and calcium. I know me, mom, and my dad as well. We don't like taking medications. Even me, I don't like to take Advil or Tylenol. We just don't like to take pills. We didn't have a lot of pills growing up in Ghana, so it's not really. We don't feel like you have to take a lot of pills all the time. However, it's important to try to get more vitamin D and calcium into your body because just eating it alone is usually not enough. The numbers to memorize. This is a confusing thing, but the main important numbers are 800 vitamin D. 1200 calcium. That's 800 vitamin D, 1200 calcium. These are pills in addition to your diet every day. This is for a normal young person who has a regular diet, who isn't really at risk for osteoporosis. However, when you get older, meaning women between that age group, 50 and 70, meaning postmenopausal women, your bones are going to be a little bit weaker because you don't have the estrogen anymore. Remember, estrogen protects bones. And without having estrogen to protect your bones, you're at risk for having weaker bones. For those populations, our abreuas in the group, no disrespect, but it's just facts, vitamin D should actually be increased by about 50%, meaning instead of just 800, you probably should be taking 1,200 units of vitamin D every day. And also it's 30 micrograms, but 1,200 units of vitamin D. Then your calcium, instead of taking 1,200 milligrams, you should be taking 1,800, so increasing it by half, increasing it by 600 milligrams, 1,800 milligrams. So if you wanted to take a screenshot of anything, lots of recommendations online, but this is the general consensus. If you're at risk for osteoporosis, meaning you're an abreuas or otherwise old person like myself, I'm very bald, you should be taking some type of supplementation, and the numbers you want are vitamin D, 1,200 units on top of a regular diet, your normal fufu, your normal kenke. You want to be taking at least 1,200 vitamin D, and then calcium, 1,800 milligrams on top of that as well. This is why, I don't know why I put this slide further. I should have led with this slide. Y'all forgive me. But this is why it's kind of important to supplement this. We can see here that, barley green, kenke, ninina is not really here. all those foods are actually pretty low in vitamin D. Also, a vegetarian diet, a vegetarian-based diet, you know, a lot of dairy products where we get most of our vitamin D from. So you may end up deficient unless you're paying attention to which vegetables have a lot of vitamin D in them. If we look at here, just going down, things that Adventists can typically eat that would be, even if it's not a vegan thing, but normal, providing for a meat in the diet, what would see vitamin D in would be salmon. I actually eat a lot of salmon, has 360. So vitamin D, remember, we want to get to at least that 800 a day. 360 means I have to have 2 big salmons every day just to get close. That's a lot, right? I don't want to eat that salmon. That's not cheap. You know what I'm saying? So you can't be eating too much of that. Orange juice, even half a cup of orange juice is only 50. So you need like a lot of cups of orange juice to get to 800. That's a lot. It's very hard to drink, and all these stuff has a lot of sugar as well. So that's a problem. Milk, again, only 100 units of vitamin D is in there. So you need 8 cups of milk to get to 800. That's a lot of milk. Egg yolk is okay. Swiss cheese, these things have small, low amounts. You have to eat a lot of them to be actually able to get to the numbers that are found to be healthy for your diet. Calcium is even worse, but again, we're trying to get to 1200 at least a day. Canned milk, yogurt, some of them have 3. So 1 cup of yogurt, in order to get for the only has like 300. If you're trying to get to your 1200, you got to eat 4 cups of yogurt. That's a lot. At the same time, as we discussed, a lot of Black people, African American, our growth were lactose intolerant 2/3 of the time. So eating this yogurt, is not going to be easy on your stomach. It's not going to be easy to try to get all of this dairy products in enough of a concentration, enough of an amount to really keep your bones strong. If we're talking at other things, so this is silk almond milk. This is straight from the internet. I think when I made this talk not too long ago. Almond milk, this is good. Non-dairy, even 30 calories, that's okay. But if you look at the vitamin D amount, only 10% is in 1 serving, which is 250 million. That's 1 cup. So 10%, you have to drink 10 cups of this unsweetened almond milk just to get enough. That's a lot in 1 day. Calcium wise is 30. So you can probably get your calcium there. Remember, we're trying to get to 1200. This has 400, about 400. So you would expect about 3 cups to get there. 30% times 3 is close to about, the 100%. Even still, 3 cups of that just to get the calcium, but you still got to drink a lot of vitamin D. All that to say that I would think it's wise to consider supplementation, meaning taking pills, vitamins in addition to your normal intake, because it's hard to get enough intake. And again, we didn't even talk about fufu. We didn't talk about dawa dawa. We didn't talk about bodie. I don't know how much vitamin D. Maybe someone can do that study, but I would imagine the levels are not as high as you would expect. So vitamin D, just to highlight, it's a picture from the internet. You want to be able to get this certain amounts every day. The last thing, so exercise, vitamin D and calcium, and also screening. Usually the screening does not have to be, again, every year. It's once every few years. Sometimes people need it more often if they're at risk. Some people don't need it as often if you're not at risk. You should really just ask your doctors. If there's one thing you can memorize in terms of a term to ask your doctor, you can say, doctor, I know I need a bone protection planning. When is my next DEXA scan due? And your doctor should be looking at you and say, this person is a smart person. They know they need to be doing it. And also they're keeping me on their toes. So she can make sure she scheduled it quickly for you. So make sure you know what a DEXA scan is. That is this scan here, the person now sitting in the machine. You want to be able to get this DEXA scan to know whether or not you're increased risk for osteoporosis. So treatment, we talked about bone protection program after you've been diagnosed. We still need to continue with that. Still exercise, still vitamin D and calcium. But if you do have osteoporosis, remember this is for prevention now. If you do have osteoporosis, you probably need a medication on top of that. So let me recap. Everything we're talking about before, this was prevention. We're trying to prevent it, just the normal things, a normal functioning person. But if you have osteoporosis, even that alone is probably not enough. You would probably need a medication that is specifically making your bones stronger to be able to keep your bones nice and healthy to avoid breaking your bones. So this is all for prevention. This is prophylactic, you could say. This is prevention just to make sure your bones stay strong. But if they happen to get weak, you may need a medication. This next slide is very busy. It's just to show that there are many different types of medications that work many different ways. The most common ones are called bisphosphonates. Basically, you take an injection about once a month. keeps your bones strong. Now, hormone replacement therapy, we talked about how estrogen is how we say osteoprotective, meaning that estrogen keeps your bones strong. And so the older you get, oftentimes, in order to make sure your hormone balance is appropriate, your doctor may prescribe some type of hormone replacement therapy with a couple different types of hormones. All those have side effects, etc., but importantly, they help keep your bones strong. There's another medication called raloxifene that is important to make sure it's basically a fake estrogen, so that it's a chemical that acts like estrogen so that your bones stay strong. Calcitonin is other things that help calcium get into your bones. There's Fortea. Fortea helps helps your blood levels of calcium get higher so that you can get calcium into your bones more. And there's Prolea. Prolea is kind of expensive, but importantly, it's an injection twice a year to keep your bones strong. This one is very popular, just to make sure that. The whole point is that once you've been preventing your osteoporosis, that is important. But even if you develop osteoporosis anyway, you probably need to be on a medication just to get your bones strong enough to prevent a broken bone. Conclusion: if there was anything to take away, the main point is vitamin D and calcium supplementation. Take those pills alongside your normal diet, because your normal diet is probably not enough. No matter how much kwedu and nkatia I eat, it's probably not enough to get a good amount of vitamin D, of calcium in it. Nkatia is good, but groundnut, I don't know if it has that much calcium in it. So you might want to be taking some supplements on top of that. That's 800 vitamin D, 1200 calcium. Then if you're, again, an abreuvoir or an old bald person like myself, you do want to be taking about 1200 vitamin D and then 1800 of calcium. On top of that, exercise is most important for most things. Of course, for your heart, it's important. Your brain health is important. Also very important for your bones. Osteoporosis, what is it? It's weakened bones. Literally means holes in the bone as a result of you not having either good protein and or good calcium in that crystal that keeps it strong. To prevent it, we should be doing this: vitamin D and calcium, exercise, and getting screened with the DEXA scan. And if you do need to be treated, it's going to be one of those other medications, but it should be fine. And the whole point is to prevent you from breaking a bone that can leave you bedbound, therefore getting sick and dying. So hope this was educational. Thank you, guys. That's all I've got.
Dr. Agyeman, yɛde wase pii ɛwɔ adesua a wɔde ama yɛn. Gyidi sɛ yɛn nyinaa no ɛyɛ nhyira paa ɛyɛ. Gyidifoɔ sɛ ɛbɛdu yɛne yɛwɔ question na sɛ yɛwɔ bi ɛpɛ sɛ yɛbusa no, wopagya wɔn nsa ɛwɔ Zoom live so a mɛfrɛ wo na ɔnya kwan ɛbusa a question. Na sɛ ɔpɛ nso a wotumi type aba chat no so, ɛba so nso a ɛbɛreadi ama doctor ansa ama wo. Na so person bit ma asend the personal to me. Be on person be who say who busa question na who send a message the person not to me. I may ready ama doctor etimi atechire mu ama won so no what yase. Enti e bia do say e busa ensem bisa. Doctor me be nka busa asem yi obi di ne de abreme. Enti ni person be busa eno na afre ma kwan ma omo opegya omo nsa no so no e de omo de enso no aba. O say na me be kai mo say doctor etitwi pa twi bia ka bia wote na ne kan na ya da yi kakra nti de mensu do sa question no twi oban kwa na kama na first question pa ko de ba ye no osna owo young female akoda e o Ghana be 15 years na onantia na otogu ni 9 eso na odne ko conformity then no try x-ray. Now also you two shows at some kind of osteoporosis and arthritis of the refi. Now mo ka say no to some pill bi so. Na obusa say na akoda osasa no obetimi anya sa problem bi tresa na obusasa na what could be the cause?
That's a great question. So obviously without seeing the kid, we can't give us specific advice, but in general, what that topic typically is a condition known as osteomalacia. It's osteomalacia. It's a little bit different. What that means is that you are born either with a condition that makes your bones not stay as strong. That's usually a problem with the protein part, the structure, or there's something wrong with how calcium is treated in your body just as a child. That results in your bones not being as strong. That'll be a little bit different. Usually it's a result of either diet or some type of genetic or situational thing. The diet one is very rare. So that's probably rickets is what they're talking about, a result of just not having vitamin D and calcium. But most of our foods now are fortified with vitamin D and calcium, most children's foods. So cereal, formula, all those milks are fortified that children eat have enough vitamin D and calcium that usually rickets is not a problem. But the condition I'm probably talking about is osteoporosis or otherwise some type of rickets there. And it can happen, but it's not as rare. If it does happen, that's probably what your doctor is talking about, giving supplementation. And then sometimes if the bones are too old already, meaning that a child is grown, there's usually surgeries you can do to correct on that. But yes, it is possible. And the treatment is usually with medicine.
That's you said pano atiase kama yɛda wase pii. Oh, Mr. Jabo, Pacho, wetimi akasa. Opening Jabo. Pacho, ebia so kasa o me too ho. Nti no.
Oh, sorry. Okay, my question is, learning from what you have just taught us, I know human body is made up of bones, but anytime we Black people, especially Ghanaians, complain about bone pain, it's always around our knee or our back. But we got bones throughout our body. Why is it that it's not our hand or our head? And also, do you recommend special exercise for the stronger bones?
That's a great question. I found two questions in there. One, what exactly is going on with knee and back pain, and how can we, any specific exercise that are good for bones. So what the condition you're usually talking about is called arthritis, which is all related to wear and tear. So arthro, remember we talked about osteo. Osteo means bone. Porosis means holes in the bone. Arthro means joint, and itis means inflammation. So it means inflammation in the joint. What are joints? So, we have these bones. God gave us these bones. There's 206 of them. Whenever they meet together at one specific part, we call that a joint. And they have to move, in appropriately so you can walk, so you can carry things. So anytime you have a bone that meets another bone, it's a joint. So if I'm looking at my fingers here, this finger where it bends is the joint right there. In between those bones, you have a tissue that's just a soft tissue that allows those bones to move next to each other smoothly. That tissue is called cartilage. You've heard all this before. You guys just bear with me. It's called cartilage. So whenever you're eating chicken, the white stuff on the end of the chicken bone is cartilage. You know what that is. Cartilage exists so that bones can move smoothly against another bone. Also, when you're walking, so things are gliding smoothly. With time, things wear out in the body, right? We have a sin problem. Things spoil. Fruits rot, grass spoils, trees die. Some people's hairline goes bad. Naturally, joints cartilage wears down. It's just a normal part of life. Some people, the joint cartilage wears down more. Some people, it doesn't wear down as much. But ultimately, most people, the joints in the body is going to wear down to some things. That knee pain and that back pain is usually different levels of arthritis in the body, meaning that because you are using those parts of your bodies a lot, the cartilage wears down, and you develop arthritis. The inflammation wears into that cartilage and you feel the pain. Why specifically we see it in the knee and in the back actually makes a lot of sense if you think about it deeply. The main issue is that those parts of the body see a lot of weight and stress. Whenever you're walking, your foot hits the ground, that force of your foot hitting the ground goes to your knees, your hips, and your back almost immediately. This is why when you jump and you land hard on something, yeah, you feel it in your foot, but you also feel it in your back. This is the force is all centered in your knees, hips, and your back. Because of that, a lot of people have back arthritis, the back pain you feel. A lot of people have hip arthritis, which results in a hip replacement. And a lot of people have knee arthritis as well. So what is that pain? It's typically levels of knee arthritis. Usually it doesn't need surgery, but sometimes it can. And it's a result of forces as you go through your normal life being concentrated. Those parts of your bodies just feel it more. Your hands and your shoulders are actually not weight bearing, meaning that you don't walk on your hands. Most people these days aren't, heavy lifting stuff. carrying things all day on their hands. So those joints don't feel as much stress. They're not feeling too much of the weight of life. But now we all walk up and down stairs every day. So, your hands and your elbows, they're not feeling that, but your knees, your back certainly are. That's why you feel it there. In terms of exercises, honestly, to speak practically, most things you can do at home are going to be good enough to keep your bones strong. There's nothing special you need. If we were to talk about it, even practically, even just walking every day. In space, again, we talked about the astronauts not having weight. So because they're in a weightless environment, the bones get weak. So because of that, those studies were done a long time ago. These days, they all have treadmills. They have simple treadmills in the space stations in space. And when they're up there, NASA has these treadmills, they're strapped down and they're just walking literally. And that motion of walking and stepping on the ground, and it's forcing those muscles to work against your bone. So even just walking every day is good. Jogging is even better. A lot of times we all have, bone pain, joint pain, hip pain. It's hard to jog. But if you can jog on soft area, grass or a nice track, even just around your house or around your building outside, that helps. Taking stairs, if you can, even that amount of exercise. And then probably the best, I would say, for any person who just wants to, if you don't want to get on the gym, these expensive things, if you can, either buy a bike or just have a cheap, regular exercise bike in your place. Just exercise bike. Find a cheap one, $50, $70, $5 from someone, and just ride it. Just doing that bike is good for two reasons. One, it's good for, again, just muscles pulling on bones to get them to be stimulated and stay strong. And then also less pressure on your knees. So riding a bike is not nearly as painful on your knees and your hips as walking and running are going to be. So even just walking, taking the stairs, and getting an exercise bike, those three exercises are really good just to make sure your knee and your back pain and really your bones stay healthy as well.
Hi, I'm fine, but to clear this, is arthritis the early stages of osteoporosis, or each one function differently?
Correct. There are two different conditions. So we'll say there are two different chapters in the book. So people with incidences of osteoporosis don't have any relationship of arthritis, and people with arthritis don't necessarily have a higher incidence of osteoporosis. They're two different things.
Okay, thank you.
No problem.
Upon you boy that was our question out or the buy. It's a question me and Sabine so abba. To maybe sa first one. Dr. Obi Busa was say the fingers the fingers no what it pains pa ewu pa na yado sometimes we feel say there nerves ni na adameji we said ni sa ni sabun kum no fingers no elbow kum no within fanya hwe na advice ben abutimi e dia man.
Great question. Again, without seeing you, it's hard to tell. There are lots of things it could be. The most common things that cause numbness and tingling in your hand, just on an educational basis, something called cubital or carpal tunnel. Carpal tunnel you've probably heard of. The main point is that, that picture we had of the spinal cord being in our spine, right? Nerves, they all come off of that spinal cord and they go all the way through your body to your fingertips here. Along that entire path, they go past a lot of different things, and sometimes those things can get tight. So BB is in there and it gets tightness around your nerve. The nerve will not work properly. And the first sign of nerves not working properly is usually numbness and tingling or some nerve type pain. Specifically in the hand, usually the nerve that supplies these muscles here, the deep in your hand, that nerve sits right here. This area is called the carpal tunnel. Carpal means wrist. So it gets tight here. So when people have tightness here, they get numbness and tingling in their hand. And usually you can use a brace, just a regular brace you can get from Walmart, just to relax it at night, and it treats the pain. Secondly, sometimes it's on this side of your hand. It can be a nerve that's at your elbow, called that cubital tunnel. It's called the cubital tunnel. If they get tight, you feel that pain in your hand in different ways. The first thing to do is just tell your doctor first and foremost, but not just make sure you're telling them the right thing. Can't just say my name. So I tell them, it's a nerve type thing. I feel sharp tingling. I feel burning, etc. Because that'll get your doctor thinking along a different route. They'll stop thinking less osteoporosis, less arthritis. So start thinking about carpal tunnel and things. So first and foremost, make sure you tell your doctor. And then secondly, make sure you tell them to say those nerve things. We call them buzzwords. When you say words like that, it helps them realize this is probably a nerve problem going on. They can get to to answer a lot quicker.
Okay, and Dr. Edwase. Now me say can be up person kasa no upeja on sa mefrel. Nti no yense no so. Obi this question bi Abraham has say things are really very short one. Was say person o repeat amount of calcium ne vitamin D. Our ma fie no 50 to 70 years no mo here no. The amount of so repeat it now.
Of course, it's 1,200. So vitamin D should be about 1,200 units a day. 1,200 IU, and you'll see IU on the bottom. 1,200 IU. Vitamin D3. Calcium should be about 1,800 milligrams a day. And honestly, you can take a little more of both and be fine. But just bring that to your doctor, because you may have another condition that, you know, we're not talking about that could be a problem. But usually people who don't have too many medical problems, taking those amounts, 1,200 vitamin D and 1,800 of calcium should be enough.
Okay, that's it. Maybe some question you chat. Na me we are na Auntie Vivian. Boama now akasa. After this question, now patronal the question no aba. Obi busa say, ye wo anwane bi wo hodoma udi a M1 calcium, you know, absorb ye into system. And now say me fa do kwa so nka ho preko many papro no. And say be wo dru bi hodoma udi a twetwen na say anwane bi twetwen wo calcium no ye free body ni ma na. And that's when you hold my M1 calcium no absorb into two-way question.
Got it. The short answer is technically yes, but the real answer is practically no. No. If you're eating enough, you should be okay. I think vitamin D is one of the fat soluble vitamins. There's 4 of them, ADEK. That's if you're eating a lot of fatty foods, you shouldn't be absorbing the calcium, the vitamin D as much. But as long as you're eating a healthy amount and taking the supplements and eating regular food every day, you'll be okay. So I wouldn't be too concerned about things that steal calcium away from the body.
Oh, okay. And that's it. And then Auntie Vivian Pacho with Nakasa.
Yo, hey, doctor, yeah, that's papa. The same busa say milk, no. Also the almond milk, no, soak one, no. Our market with me at all. But what about say one kasa we or milk, okoto almond milk, almond now kasa we will fear. It have enough calcium. A chain ya beton stone and another stone have more calcium than ya one kasa we will fear.
That is a great question. To be honest, I don't know. I cannot tell you with confidence. I really can't. But all I can do is suppose and guess. I know for a fact most products we get, especially milk and cereal, are fortified, meaning that naturally they don't have that much. They have some, but they don't have that much. So the government actually makes them put more in just so people are getting it in that natural amount. Because of that, I would imagine that making almond milk at home is probably less of an amount of vitamin D and calcium than buying it in the store. Only because I know the store-bought ones have to have some extra afrefrum. So because there's extra that they're putting in there, it's probably that the natural one doesn't have enough. But I'm guessing. To be honest, I'm guessing. I'm not sure.
Okay, thank you.
Of course.
Okay, my second question says.
And so you too, home.
Pacho fan chemi. Oh, okay. Auntie Vivian, because my chance madam second question about.
Okay, or mention cheese. But cheese, you know, as an Adventist, we don't regularly consume much cheese any our kind. It is as a cheese, and so I'm saying it's good for calcium and vitamin D, all kind of things. So it does good to eat too much that cheese now. Mention
Cheese has a lot of fat in it as well. So
that's what I'm worried about.
You're right. See, you know, I'm with you. You know, me trying to eat too much cheese. Mostly is just salmon I eat, and then try to drink, you know, milk, milk. But it's not usually enough, which is why I think the best recommendation is the supplements, the pills on top. Okay. Yeah, it's hard. Yeah, it's hard. But it's good that we know this. You know, 300 years we didn't know this, so people are getting. You know, people weren't living as long. They would fall and break a bone and not know they have weak bones. But now we know. We have modern science, so we know we should be supplementing.
Okay, thank you.
Yes, Auntie.
Auntie, there was no question what they buy. Now, mess the use iPad no, so a question. The doctor said, "What kind of question they are?" And then correct to me, you say you are going to Basuna Obusan that director Mayania. That's Dr. Swakina. What's the question I see here now? Balance and so there.
Not me say me use salmon calcitonin for a long time because now I had an ulcer, so the doctor didn't want to give me a medication, but rather the doctor gave me that calcitonin so that the spray for like an inhaler. So when I tried it for so many years, but after that I stopped using it. And when it comes to winter time, I could see that I have some sinus. I have a problem with when I breathe the cold weather, I have some sinus. So I'm thinking that if it's because of using it for so long, is that a side effect for that? Because before I thought it was I was having an eye problem, and the doctor told me that with the symptoms that I'm describing, it's not what is causing that. So I realized that because for the calcitonin salmon that I was inhaling, that's what is causing that. So could you please explain it if that's the side effects for taking it for so long? Thank you.
Auntie, you're very smart. I think you're really trying to put it together. And just thinking without knowing you very well, probably, but your doctor does know you better than me. So it'd be hard for me to tell. He knows exactly what you're on. I will say calcium, the inhalant, works really well. And there's no particular side effects listed that are related to we call sinusitis, inflammation or symptoms in your nose. However, in general, taking things in your nose for a prolonged period of time can lead to nasal symptoms. So if you've noticed it, I would not be surprised if the calcium was, if the salmon calcium, the inhalant was the result. I'm not sure, but if it's not working for you or you're noticing symptoms, then there are other ways to use it. There's no reason to keep torturing yourself.
Yeah, I stopped it for years now.
Yeah, I'll switch to something else. I think that's reasonable.
Thank you.
It was a part of question or the buyer. And I'm afraid you should first Ghana line on that or the question about.
Oh yeah, I mean, my question is, you do what you answer is just like a habit, not like a cracky answer. Does that have any negative long-term effect?
Zero. The people have studied it for a long time. It's fine. I just did mine just now. It's fine. You're good. Yes, sir.
Unless there was another question, going in a baby. My friend, we use iPhone. No, we are that. My question. I think it's a bit Eda Paul. Eda Paul, what's your question?
That's a power.
Uncle.
It's a good job.
Thank you, Master.
Very good. I also see a problem. Yeah, Nancy. Exercise, you come can be an answer. No, I call Ghana say not the beer, I come here 5 months. By any person in a SWAT team, I come my daily. But maybe such a no what effect you will see so OCC area as we are talking about bones, it means strengthening one.
It can. Everything has give and take. So we want to be walking a lot to build up strength, but if you're having pains and chronic pains, then there's a balance there we need to be concerned about. So I'm not sure.
Dog, it was it. Yeah. And it'll be the question about our chat name or sister who have new surgery. Pain or echo for life, and I said,
knee surgery. Usually for orthopedic surgery, the point is to restore function. That's the whole point. That can mean a couple different things. Either means you have something unstable, we make it stable, or you have something that's too big and needs to be small, or most commonly you have pain and needs to be relieved. So usually it's to take the pain away. And so if you're having knee surgery for pain, the point was for you to be pain-free, or at least have more manageable pain at the end. That being said, whenever you do any surgery, obviously we have to cause some pain to relieve the pain long term. So if you're asking about the pain from the surgery, that should certainly go away. And if they're still having pain after a long time, depending on the surgery, it should go away. But yeah, usually the pain goes away with time. And if not, that means something may not be perfect, and you may have to look a little closer at it.
was it. Now we say supplements ya bobo sui bisa calcium ne vitamin D ne all other supplements ni no. Or how be or because especially the kind of question say you come here who say supplements no and you're regretted. Na ye nimi into no ye. Or how be or
So most supplements are not regulated, as you just mentioned. But most supplements are really supplements. Like you talk about like ginseng, there's a bunch of other stuff that's like not even really, we say FDA approved. So I would recommend talking to your doctor about which is approved in your neck of the woods and neighborhoods. I can't recommend random extra stuff, right? These like herbal things, and I don't know. But vitamin D and calcium is so old and so tried and true that most of that is completely safe. Most of that's safe to say. So vitamin D and calcium are really the only supplements the only ones I'm like, you probably need more of this. You should talk to your regular doctor about what's the best needs for you. But in particular, vitamin D and calcium are just so old, and lots of people have taken them for years, that wherever you're getting them from is probably safe. There is a side effect of calcium taking too much, is constipation. So you should be making sure you're eating a lot of high fiber foods, such as vegetables, green leafy vegetables, or maybe you take a stool softener, or drinking certainly a lot of water, so that your stool stays nice and smooth, because calcium can make you a little constipated. Vitamin D, when overdosed, can have some side effects, but it's very rare to overdose on vitamin D, and there's no real side effect of taking the pill. So usually vitamin D and calcium, the only ones I ever recommend, and because they're relatively safe and there's so much data on the pills and they're usually okay, I don't recommend any of the other stuff. And then again, calcium can make you a little constipated, so I would drink a lot of water with your diet. So
that was it. Upon your boss, I put on some say old one and I say we new.
That's so a new na the question on say a morophone titru. Ya na say woman and tears woman kunku yemu say achachabi if a woman chinum near especially winina. And no osteoporosis will be announced and no see a different day. So na man who say it is from not the chicano the kunkumwe a proof hosa.
That doesn't sound like osteoporosis, so especially if they're younger, I wouldn't be the problem. But maybe they have some type of breakdown, or oftentimes arthritis when you're older can set in and make you have a deformity, meaning you're walking more strangely. So probably not osteoporosis.
Doctor, that was it. And my friend opinion yaw appear either partial with me akasa.
Yo, doc, that's a baby. I can maybe say, yes, I tissue no in between bones, say, how about why there any medication or offer which my restore tissues now?
That is a very intelligent question, Uncle. There are lots of people who have studied that subject for lots of years, because if you can make that tissue is called cartilage, as you know, the white stuff on the end of the chicken bone. But that tissue, if you can regenerate it or get it to stay healthy, then people don't need joint replacements because they don't develop arthritis. There's a place near you guys, it's called HSS, Hospital Special Surgery. There are many people in there who literally all they do is study cartilage. That's their entire job. Riley Williams, the Nets doctor, Scott Rodeo, the Giants doctor, Umunina, they studied cartilage for years. The short answer is not yet. There's no not yet. Is there something that's guaranteed? But there are lots of different smaller treatments that can keep your cartilage going. In the event that it gets damaged, we can treat it appropriately so you don't develop bad arthritis. There are lots of small treatments you can do that. Also, there's something called PRP. And again, this is not medical advice, but in general, if you were to Google the subject, something called platelet-rich plasma, or which basically you can use. You take some blood from yourself, you put into a small machine, then you inject it into parts in your body. And studies show that sometimes it can help you maintain the strength of your tissues. Some of those tissues may be cartilage. So short answer is not yet, but as science is rapidly progressing, I would be surprised if in the next 20, not even 20, next 5 to 10 years, there's something consistent that can really preserve cartilage like you're mentioning, and it's probably related to PRP.
Thank you.
And was it. This is still your question, PM for PRP one, sir. Maybe Sabisa, and you know, wow, question, you know, after I don't want us to go beyond 9:15, and you know, Mom Pija send a question or chats and soon I'll be questions here. A chat to Dr. Barnes and Amaye. Auntie Susie, a pigeon, sir. The minimum say a head at the end of the
Mepacho Debbie, Miss me pijama.
you know, which Yakasa.
You made us pa. Mepacho brow, Casano say calcium no. Yen share 1,800 milligram. Any vitamin D in so 1,200 and only 1,200, you know. And it was I say na over the counter, dear no, and I said this one more doctor. I'm out prescription and then pay me.
They'll be the same. Over the counter will generally be the same. It helps to always have a doctor who knows you. I think in general, doctors say it's because they know your diet, they know what other medications you're taking. If they are willing to write one, they will. Usually, if you take that prescription, Aquafra pharmacy, they will just point to the over the counter because usually it's so common over the counter. But if you'd have your doctor change the dosage, but over the counter is fine. You can really just go to the store, Aquafra. You'll notice that the numbers are always different. They're always a little bit, sometimes they come 1,500. Just remember, if 1,200, if they don't have 1,200, just go a little bit more. You know, if they don't have 1,800 calcium, maybe do 2,000 instead. But that was probably not harmful at all.
Okay, maybe Samson say folic acid, calcium, and I said,
Debbie, that's a different type of vitamin. That's a B. I think that's B9, but that's not necessarily harmful. But I would ask your doctor about whether he thinks you need some folic acid help as well.
Okay, thank you.
Yes, ma'am, no problem.
Doctor, I'm question what chat. I'm saying no more per job on 7.
Sure.
Well, we saw what kind of was maybe in Pakulu ni ho nti Buanakra. Obusa say odi enough odi calcium come on a bianima. E come sabe here so we take supplement. We saw kind, but says to be na the Pakulu no ni ho. Yeah.
Sure. Listen, we all could, you know, in Abraham's day, he was eating, you know, what he needed to, and you know, he lived. Methuselah lived how long? 900 years without it. But in today's modern world, it's just hard to eat enough calcium that we know would keep your bones strong. And so you can, you know, so if you're eating 2 big things of salmon a day and a lot of cheese and milk and all other things and yogurt, sure. But most people are not eating even still enough. That's why it helps to just take the pills alongside your regular diet.
No, it was it. Name Paucho iPad.
Hi, Aaron. Okay, it's me again. Doctor, I just wanted to ask about the weight bearing.
Yes, ma'am.
The weight bearing. If you have arthritis, I don't think squatting is good for you. And could you just do crunches? That is all. Is it part of it? Or because when you do the squatting, it hurts your knee, especially if you have arthritis.
You're exactly right, Auntie. In fact, that is the balance with treating people who have arthritis, because the treatment is usually exercise, weight-bearing exercise, but it hurts to use your knees. So how do you do it appropriately? The 2 things, squatting, you're right. You probably shouldn't be doing that. It's just pain. You're not going to do them right. Crunches is good, very good, but it's not oftentimes. You're not getting your whole body involved. It's a very small part of your body you're working on. You're not burning as much energy as you would doing some other activities. I would recommend 2 things just for, you know, people who have knee arthritis who are trying to do some things like yourself, trying to stay active. Walking is fine. I know walking hurts from time to time. If you can find a way, just put a small wrap on your knee to make it okay. Maybe take a little Motrin before, if you're able to and you're safe. Walking is just fine. That just may mean, if instead of, when you're in the airport, instead of taking the moving Adiano, just walking instead. Or if if you have to go up 1 or 2 flights, take the stairs instead of taking the elevators. Just walking as much as you can, that really, really helps. Maybe park a little farther than you normally do, so that you have to walk to get home and to get to all that. Really helps with just walking in general. The second one, if you have to buy something, would be an exercise bike.
Yeah, I have the bike.
That one is good. We call that low impact, meaning that every time your foot is the ground, and you again, like we said, you feel the force hitting your knee and your hip. Bike, no dear, is different in that there's really no impact, just your foot going in a circular motion.
Right.
So there's no impact. That people find that really well with arthritis, because you're not really crunching your knee. You're really going through a range of motion. So if you can do the bike, even just low resistance, just do it a bunch of times over maybe 30 minutes, that would really help.
Okay. And my second question is the Prolia is very expensive. Yeah, because you take the injection twice a year. So sometimes the insurance is not covered because it's very expensive. I did it one time, and the second time I couldn't. So I thought it was just because some insurance doesn't cover it.
You're right. That's the one we really like, but until it becomes your friend with generic, meaning until the patent is off of it and legally it can be cheaper, it'll be expensive. So I would ask your doctor about cheaper options. Most of them work about the same. I think the benefit, like that, the reason why people prefer Prolia, like yourself, is not because it works better than the other things, and that it's only twice a year. Like, it's just a shot twice a year, so it's very convenient. But if you have to be doing something else, it'll work the same. So whatever's cheaper for now. Eventually, Prolia will come off patent, meaning that the people who invented it won't be able to charge as much for it anymore. Then when that comes off, then you can take it for cheap, and most people will just have it cheaply.
All right, thank you.
Yes, ma'am.
There was no question. No, now me come some say you perceive upon by 9:15. If I say you be coach repeat to one for question my say here one-on-one advice with the doctor Hormone meet me and command the amount. Question say what chat no so no more page on sano and you be taking for last. And so. Pastor Auntie Beatrice Boafo, wait me the question about.
Okay. The question is injections na yemano. It was side effect na.
Good question. Most medications have some type of side effect. You're right. They do, but they're usually not as severe, and they're not really picked up as much. Injections-wise, not studied as much, and so the side effects profile is really low, which is why they're so expensive still. The pills that people take tend to have more of a side effects, and I don't mean the vitamin D and calcium. There's another one called bisphosphonates. Bisphosphonates tend to have more of an effect on they cause something called jaw necrosis. They also cause you'd have a hip fracture sometimes themselves. So in general, the injections don't have as much side effects. Obviously, whenever you stick yourself with a needle, there's a risk of infection and needle pain, but it's the same as a vaccine. Those things are very, very, very low. So typically, they are a low incidence of side effects, and taking the shot just once or twice a year is not very bad. So it's healthier, just happens to be more expensive.
Na pacho weekly pill na omo man so eno so it is ebi wo ho mo say monthly ebi wo ho mo say weekly enti emu ne he na say ye fa.
Great question. No, go ahead, Auntie. Sorry, you said Anna.
It's okay.
No. Honestly, they're about the same. It's what you're most comfortable with. Side effect profile Nudia is more so your medical history and other medications you're taking. Most of them are safe to be taken for a prolonged period of time. And if there are side effects, they're usually not something that's drastic. So I would just ask your doctor, just so they can make sure they basically cross-reference, they check whatever else you're taking to make sure it's okay. Then for you, it's what do you think will be most convenient? Some people like to take a pill every day. It makes them feel like they're doing something every day, they're motivated. For me, I think I'm a little too lazy for that. I would prefer to have something that's just once a week. So I take it before I'm going to separate school, I'm taking my pill. That way it's more, just it's not as cumbersome. It's not as bothersome to your life. But it's up to you. I'll just make sure I ask your doctor first, because a lot of the side effects are just due to whatever else you're taking or whatever else problems you may have going on with your body.
Okay, Dr. Medase.
Of course, Auntie.
Auntie, no question. Me ko chat no so busa wi na the use iPhone no e the question aba. Obi busa say the left thumb no e no yapa na die ba de bitnya amana basa na die no boye nso a mba pain no akọ.
Great question. Without seeing you or seeing an x-ray or knowing the history, it's hard for me to say. But I know that a lot of thumb pain in general is because of overuse, meaning that because we are all God on four, we work hard. That's what we do. And so we've been using our hands and our bodies for a long period of time. Most thumb pain is either resulting from using it too much or having an injury that you can't rest and let get better. So by using something that just relaxes your thumb, it'll probably help your thumb feel better, if nothing else. So if there is one thing, I would get what's called a thumb spica brace.
Yeah.
Thumb spica. Spica is S-P-I-C-A. S-P-I-C-A. Thumb spica. It is simply just a wrist brace, but it covers your thumb. So when you have your normal daily activities, your thumb doesn't move. So you still can do things, but your thumb is nice and supported, so you don't feel as much pain. I would just start there. Put one on and just use it for a couple weeks when you're doing activities. It may take all the pain away. And if not, I would try to see a doctor and make sure they get an x-ray so we can see whether or not it's arthritis or a tendon injury or something going on like that. But thumb spica brace, just start there without even seeing anything. If you try that, it may take the pain away, at least a little bit.
Doctor, do I say? Nempacho do use iPhone no betimi akasa.
Yeah, me pacho me dey no ejina osteoarthritis. So na mama ntem dey na pese me hu say calcium with vitamin D 1,200 together. Is it okay?
That's a great question. To be honest, vitamin D and calcium won't do anything about arthritis. The reason is, remember, vitamin D and calcium are good for your bone health. Helps your bones maintain their strength to prevent osteoporosis. But arthritis is usually wear and tear, usually a result of the joint itself, the cartilage, that soft part of the joint getting weaker. Because that process isn't really related to vitamin D and the calcium, there's no amount of vitamin D and calcium that can make your arthritis, make the arthritis pain better or keep your cartilage, your joint nice and strong. In fact, there's no supplement that exists yet that can keep arthritis away. That is the topic of hundreds of billions of dollars of research. Because if you could find a chemical or some type of guaranteed treatment that could keep I'm sure it's probably your knees or your hips from being as painful.
Knee and ankle.
And your ankle, correct. If you could find a way to keep arthritis away just with some supplements, that would save a lot of people a lot of pain. So unfortunately, vitamin D and calcium won't work for arthritis. Only works for that is bracing, trying to do some exercises, pain control, and then hoping it doesn't progress so bad that it needs a surgery. That one is prayer.
So there's no need to take this calcium and vitamin D. For
osteoarthritis, no. For osteoporosis, I would say yes. I think it's important to prevent that one. But they're two different problems, two different chapters of the textbooks. That's what we like to say.
Oh, okay.
Yes, Manti.
Oh my goodness.
Oh, sorry.
Anyway, one way or the other, I already took my calic nefri me ankles ni me enu na yedi pins ashishim. And I still facing one side pain. And X-ray no, and our CT scan. First, doctor say that the one no irritated, into pain no, it just unbearable. And or kasa obetumi ayi kasa that the end back one free ho. After I say TT no chest surgery na hearing and only na some person procedure. There's no guarantee say pain no and some. So I'm confused.
It's hard to say. That's a difficult problem. I'm sorry you're going through that, Auntie. It sounds like a complicated problem. And oftentimes, that's a problem that's faced, whether doing something will make you worse or better, or whether or not we know that doing something will even affect it at all. So I'm sorry to hear that, Auntie, but we'll keep praying.
Then prayers alone.
Thoughts and prayers.
So no medication can help me.
For that problem, I'm not sure. I would have to know the exact problem, but
we talk later.
Yes, Auntie.
I will let you go. We will talk in chamber. Backstage.
Mercy.
One more question. This is a short one. Can I go ahead?
Okay.
Can I? Okay. Yeah, Doc. I just want to ask that arthritis cause inflammation.
Great question. Yeah, arthritis literally means inflammation of the joint. There's many different types. Most people have what's called osteoarthritis, as Auntie was saying. So yeah, it causes inflammation and swelling there. Sometimes it can result in swelling of your knee that may need to be drained, but yes, it can cause it is in fact inflammation.
All right, thank you.
Yes, Auntie.
Auntie Vic, remember question number. Maybe we say last question out from chat on that area. Auntie Vic, with Macassa.
Me pacho you ma me das nyame nhyira. Na nim say my late. Na me na baako ne fa. Nia baako no me pese mbusa sa de ntina onyankopon wo boye nyina pepepe. Me fa say yi ma me de o ye example. Na mi kotodwe ye nyina nante me nante wo so nante. Ade ntina mi kotodwe timi ya me ya na ehi na esekasa itwe animu. Na wo de entimi ntwe animu. Na kese ehore ya mente ase. I didn't think about that. What's the question, Nancy?
Yes, Auntie. That's a very perplexing topic. We don't know. Even Uncle Emmanuel here, medium pai. But Uncle Emmanuel still has excellent hair. How do these things happen in difference? Well, our old teacher used to say, we're all different on the outside, and so we'll all be different on the inside. It's hard to tell where. If you're a professional athlete, that one is easy to see. You use it too much, and so you get hurt. But if you're not, why do you develop it? Usually it's genetic. It comes down to your DNA. Some things happen, some things don't happen, and it's hard to tell why. Because it's very difficult to figure out exactly why, most people focus on treating it. But there is, since most of it's genetic, there's a lot of research these days into what genetic problems we can try to fix. And that's sort of the next stage of science, is fixing people's DNA, so that if there is a gene called the COL1A9, you don't need to know this, there is a gene that is associated with arthritis, and people are now looking at whether or not you can treat that gene so that people don't develop arthritis. But short answer is, it's hard to say. We're not sure.
Me da simpasho e fa na ka ho no ye e bia o kan na bia ma anti de ye e tro bia me na yankasa ya na ye nom mintimi hu adekro on and off e ba na ekọ but you say minima adekro nti e ba ne sa e nom so a me fede me misa so so a me fede but ya na ye nom mintimi hu adekro.
That's a great question. Again, without seeing you or knowing, it's hard for me to tell. But usually when people have numbness or nerve-related pain in their foot, it's a couple things. Either the blood flow is incorrect, or there's some nerve damage, and both of those things should be checked out by your doctor closely. The nerve can be damaged by either, we say, mechanical, maybe there's a pinched nerve, where there's a nerve that's getting pinched and it's causing you nerve pain, or diabetes, or some other conditions that cause the nerves to get damaged. Regardless, definitely bring it up to your doctor, because the blood flow one, as well as the diabetes and pinched nerve, should be brought to their attention. They need to be looking closely at that, because I'm sure you want to have your foot dealt with appropriately.
Yo, Doctor Medasi, Master Medasi.
Ma Melinda Pijanesa, so my last one. Man, with me akasa. You say your questions be, but you say a DM also. In case you be question be or try hand pa met me aboa ama what mean Dr. Akasa. Now what me ama on chichirimu. Enti man na bacho for question every.
Ima, thank you. This is Evelyn, by the way.
Okay.
Hi, good evening, Kofi. I'm coming in late because I was coming from work, but I don't know, so we'll be able to start this question. It's done busa. So in the winter time, that's where I noticed it a lot. Mainly but winter time, in my kneecap, I feel like this kind of tingling sensation, like it's I don't know if it's weakness. It's always winter time, not any other season. I'm not sure what's going on with that.
Great question. Again, without seeing you, it's hard for me to tell, but kneecap pain is pretty specific and it's usually only a few things. It's probably what we call early arthritis. To put it complicated, it's patellofemoral syndrome. Usually the patella, the kneecap has the thickest cartilage in the body. So usually people have damage there for a long time without knowing it. The best thing, again, I don't know, but the best thing for that is usually physical therapy. And it starts with actually stretching your quad. So your quad, that's right on top of that. Whenever you're running and doing something before activities, really try to stretch it well. And oftentimes in the cold weather, like in the winter, people feel that pain a little bit more because our body's a little more tight, right? Things are cold, a little more rigid. We're less likely to be stretching. And the body's kind of contract. So because of that, your quad pulls, this is getting technical, I'm sorry. Your quad pulls on your kneecap a little more than usual. And so you have a little bit more pain there than usual. The first thing would be to probably recommend just stretching it a lot more than you normally would. And then tell your doctor about it too, because there's other conditions that it could be. You really want to make sure to get an x-ray just to see if everything is still looking normal in terms of the structure. Does that make sense?
Yes, it definitely does. Thank you so much, Dr. Kofi.
Hey, no problem.
Evelyn, yeah, that was it. A question. Last question from the chat. Now, the questions in now, but no people say, osteoporosis, it may affect the upper part of the body. Now, exercise bit me now.
Great question. This is actually my specialty is shoulder arthritis. So, yep, that is literally, I love that. Unfortunately, it sounds bad, but that's an important problem we definitely try to deal with. So yes, it can. Usually it's related to problems of your shoulder, something called the rotator cuff, tendons that help stabilize things. The only exercise, most exercises can keep things stable, to keep it nice and strong, but there's no exercise that can prevent it. But you definitely can strengthen it. Most of them are what you would see normally just by going to the gym. You ever had those stretchy bands? Just use them to stretch and strengthen your shoulder in all directions, which means using the bands at the gym to go up, using them to go across, using them to go to the outside, and using them to go up the back. I'll say it again, using the bands to go up, using them to go across your body, using it to go to the outside, and using it to go up your back. Just by doing band exercises with that, it really helps strengthen all the muscles here so that even if you are developing osteoarthritis, it can definitely keep the pain away. In terms of osteoporosis, your whole body is usually affected by osteoporosis. It's not that one or two bones are weaker than others in general with osteoporosis, but all the bones are typically. So if you have osteoporosis and they find it in your hip, you probably have it in your wrist, as well as your shoulder, as well as your back. And so that's why when you take medications that help treat it or prevent it, they go everywhere as well. So yes, you can affect the upper extremity. Doing exercises that just go with bands across and the other way and up and around your back helps keep things stable and strengthened. So even if you're developing something, your body, the muscles can pick up the slack, so to speak, and be a lot stronger than without.
Doctor, there was a P. Me, I'm asking your last question, but okay, so that your specialty, we have a question. We beside the minimum be a problem. Problem say on your accident and on your problem on the shoulder. Now I surgery. I'm a pain. I always say surgery affects no, but I want now what pain kakra and the continuous pain. But what pain kakra No, free say e kaka nam kakra. Any advice for nipa kro?
It's hard to say. It's hard to say. I mean, there's so many things that could be going on. You know, which surgery did he have? Did they put anchors or stitches in there or something? The best thing would be to try to go back to the doctor who did the surgery. A lot of times people might go to a different doctor. If that doctor you feel like, say, he doesn't really pay attention or doesn't care, you should try to go back, because that doctor knows your shoulder or even any body part more than other people. And so he knows what he did. And if there's something going wrong, he can be keyed in to what may be happening earlier than other people. Other people may be like, oh, sometimes this, sometimes it's that. But if the person who did the surgery, you come back to them, they know. They say, oh, okay, I remember we did this. Perhaps it's this problem. So it's hard for me to say, but if you can really get in close with the doctor who did it, he should be able to get to the bottom of it quicker rather than later.
Oh, that was sippy. I mean, instead of that uncle so in your casino, I'm on him, didn't cost. And it come on, never send a my, I mean, instead of P now on count. You say, we didn't crop yard. Kafra. I mean, instead oh, any mestre say, I say, Pastor Sakura, Pastor Ibi, Umbako, I was so. Nanka obo mpaye maye na odi Dr. Kofi enso no ahye nyame ensa amaye na ene edi program no aba no awieye.
My mom mpaye na ne nyame yeda wase anwumre wodo ene wahumobro ene wayem ye doso yeda wase se wama Dr. Kofi Agyeman anwumre wabɛkyerɛkyerɛ sɛ bɛyɛ a yɛnka sɛ ɛne yɛ nipadua no yɛbɛnya mu ahoɔden ne yɛde ayɛ wɔ adwuma. Nneɛma a wakyerɛkyerɛ yɛ Awurade yɛsua bebree afiri mu. Enti bua yɛn na titiriw no yɛne yɛnya pains na yɛnni wɔ haw biara no. Yɛnsua nneɛma a wakyerɛ na ɛbɛtumi aprevent ɛma saa nneɛma yi ɛma.
Amen.
Yɛsrɛ say Awurade ka yɛn ho. Obi nso a ɔwɔ pain mu no yɛsrɛ boa no na dwodwo ano ma yɛn.
Amen.
Hɔ a doctor betumi atoa so aboa even behind the scenes ama yɛnya ahotosoɔ ne yɛn ho adwodwo yɛn kakra a Awurade yɛsrɛ wo. Saa bere wabɛyɛ part of us. Enti yɛhaw no dodo no a ɛwɔ nipadua fam a nipa fam a obetumi ayɛ no Awurade ma ne nya interest na wɔmmoa wɔn a wɔhaw nyinara.
Amen.
Yɛsrɛ wo anwummerɛ sɛ wo ne oduyɛfo kɛse. Eti yɛsrɛ wo madodo a ɛwɔ pains ahodoɔ nyinara. Awurade yɛsrɛ wo dwodwo ano ma yɛn anwummerɛ.
Amen.
Yɛnim sɛ na ɔtwe nkɔ na wieɛ no na wahyira yɛn nyinara. Na wama yɛ apɔmuden a yɛbɛtumi de asom wo. Anadwo a yɛkɔda yɛ de yɛn honam nyinaa hyɛ wo nsa.
Amen.
Ma abɔfo no mahwɛ yɛn so ɛmmɔ yɛn ho ban. Adeɛ kye anɔpa na wɔde yɛba nkwa mu a yɛde aseda no nyinaa bɛma wo. Titi w'anim kyerɛ yɛn. Ne bra yɛfiri ha so yɛsa atoa so bio. Na yɛde yɛnnua yɛba Dr. Agyeman ahyɛ wo nsa.
Amen.
Bra wɔde bɛdi adwuma yi Awurade yɛnim sɛ wobɛtumi de ayɛ nneɛma bebree. Nanso ayɛ nhyira ma yɛn nyinaa. Enti hyira no. Hyira no adwuma so. Ma no nimdie na deɛ wɔyɛ biara ɛnyɛ yie. Wɔnam baabi korɔ nka sɛ oh me call first Ghana na me nhyira no adɔɔso bebree.
Amen.
Hyira yɛn nyinaa anwummerɛ yi wɔ Yesu din mu. Amen.
Amen. Amen. Pastor Edwase, Dr. Kofi Agyeman so no Edwase. Me frɛ be din komo awachire. Na me kae nyina se Nyankopɔn bo a ɔkyena so no edwumadie no bɛtoa so akɔso. Nyambo ɔkyena yɛ hwekyin sakakra. Ye sɛ ɛkɔ Bible mu ye kɔhwɛ sɛ anointing so be yare you say my anointing say any say palace bitie say the Bible kasa fa ho say se bi eboa enipa setena mu ene se bi a yare semu so no etsi bi etie nyambo a eno nyambo ochina sofo panyini baako beka ho asem nyakopɔ bo a Tuesday akɔhwɛ yeyem so akɔhwɛ problems ahodo enipa wonya no wo yafunu mu na Tuesday so no doctor baako so asisi ne ho na ɔde abrɛ yɛ na me kae sɛ yentonko so yentu yensa amfrɛ afoforo especially one a omunya akwanhwɛfo na yen so ayɛ akwanhwɛfo no yenka aka yɛ ho sɛ be ya ibenya chefa kese awa district say mu because enye easy say obenya doctor panini bitse Kofi na wabala iso na obecheche no mpemu say enye easy say obenya obisa aba no asana daji aboa e kwan say so enti mu nyina nsa no nso na enye ne sa step be ya by the end of the week na yetimi aye insura da yetimi nya a number hodo a de bebo apomodin enso no ho eban na me kas na ngopo won insura e wonka nyina ye ho Oma ye nanso ye na oma adepa enchie e woni din ni mu amen. Nyambo o